communications if we can't work in a pinch.
We're live.
Thank you. Good morning, everybody. Welcome to the staff meeting for February 9th, Tuesday. It's 9 o'clock. With that, we have one commissioner that's missing today, has a personal item handling, and so the four of us will handle the staff meeting. So hand this over to Manager Tom Stoltz.
Good morning, Chairman and Commissioners. This morning we have two items for staff discussion. First is we'll put Mr. Labrum up. He has an electrical board appointment. That is part of policy now. We vet applicants with the commission in a staff setting before we actually push it to vote at an upcoming meeting. So he will go first. And then Tim has an update or a weekly update on the vaccination process and how it's going within the community. So we'll start with Chris.
Okay. Chris Labrum, good morning.
Mr. Chairman, Commissioners, good morning. Good to see you all. Chris Labrum, MABCD for the record. And yes, so our electrical engineer on the Board of Electrical Appeals, Tim Lentz, a great member, served us really well. He has retired from his job and has decided that he would like to retire all the way around. He informed us of this in August, late August. So Emily was able to post this through the process at the beginning of September. It was advertised, and we did our best to get the word out through September through December. We only had one applicant during that time. His name is Christopher Vale. He's actually an acquaintance of Tim's. He's younger, but Tim was one of his mentors, if you will. So he has applied, qualified member. 8 years of experience as an engineer, not known really well by us, but we have worked with him. Have no indication that he wouldn't serve well. He does know the members of the board, knows the industry well, so we are recommending that even though it is only one applicant, that we accept that applicant and appoint him to the position.
Okay. Well, it's sad, too bad we only have one applicant, but it sounds like it's a good reference.
Correct, sir.
And having another young up-and-comer with the electric world is good to have on your board, I hope. So that'll be presented to formally approve.
If no one has a problem, we'll put that on next agenda.
Has anybody got any questions about that? Yeah. Go ahead. Oh, Commissioner Howell. Yeah, sorry.
Thank you, Chairman. So just curiously, will he be filling the unexpired term of the previous person, or is this going to be a new term?
So it will be filling the unexpired term.
So this will come up again in something fairly soon?
Correct. Yes, so he will complete that term and then would need to be reappointed at the conclusion.
Okay. I think it gives us a second opportunity, should this not be, if we find out there's something wrong with this appointment.
That's correct, and a very good point, Commissioner.
All right, thank you.
So I believe then that for next week, as Mr. Stoltz said, we'll have the resignation of Mr. Lentz and the appointment of Mr. Vale on the agenda for you.
Okay. Thank you, Chris. I don't see any.
Thank you.
Okay, go ahead. Commissioner Howell.
I just want to clarify, is this a joint appointment between the city and
So
county?
this is a joint board, but this is a county appointment.
Okay, all right, thank you again.
Okay.
Good. All right, Tim, vaccine time.
Good morning, Commissioners. Tim Coffin, Deputy County Manager, here reporting on the part of the Health Department and the efforts that they've made this past week towards vaccinations. I've got numbers to report by Sedgwick County. Again, there are a number of different ways for vaccines to come into the community. Through the VA receives vaccines directly. The national pharmacies that are vaccinating in the long-term care facilities, those vaccines are coming in the community, and then we get vaccines. And so we have used our primary vaccination site at Interest Bank Arena. Through yesterday, 16,924 people have received their first dose. 7,295 people have received their second dose, and so they're now considered fully vaccinated. And so that gives us a total of 24,219 doses that the Sedgwick County Health Department has dispensed. And so add to those numbers that happen in the hospitals. The hospitals have vaccinated the bulk of their staff. Now, most of them have received their second dose, and then the other ways for vaccines to come into the community. But we've vaccinated 24,000, dispensed 24,000 vaccinations. Right now, we are scheduling this week for individuals 75 years and above and healthcare associated workers. We opened that up yesterday afternoon, and there are very few appointments left this week. And again, our practice is to offer appointments based on the vaccines that we have available and to make sure that everybody that has an appointment gets a vaccine. So we have appointments available right now towards the end of the week for those folks that are either over the age of 75 or we're continuing to vaccinate healthcare workers. We have had to make some cold weather adjustments this week. It's brutal cold, and so we've made two different adjustments. One is at Intrust Bank Arena. We have worked with our partner, AJ, and the folks at Intrust Bank Arena have been great to work with, and they have covered the ice on the floor, and so we are able to use the floor space in the arena for both vaccinating and for observation, and that gives us much more queuing area, and so we've been able to move the lines and everyone inside. We don't want anybody standing outside waiting. So we've made that adjustment, and then we've also reduced the number of appointments to make sure that we don't have anybody standing outside. So we've got about 1,100 appointments a day this week as opposed to the higher numbers that we've had in the past. The other cold weather adjustment that we've made is that we have reduced the volume at our drive-through location because we can't risk our staff being exposed to long durations of cold. So we've built in some warming time for our staff, and then we've reduced the number of appointments there. So we're again going to see fewer folks through this week because of the weather, but that keeps our staff safe and it keeps our guests that are coming in to get vaccinated safe as well. There are a couple of other challenges that I wanted to address today. One of them has to do with the call volume. And so yesterday we were overwhelmed with calls, and the bulk of those calls were folks that are approaching their 21 days for the time from the time that they've received their first vaccination, and so they'd like to schedule that second appointment. And we don't have those appointments available by the end of the day. The ability, or by noon today, I'm sure, the ability to schedule second appointments will be there for folks that have received their first dose of Pfizer. And so with that Pfizer vaccine, the minimum interval between dates is 21 days, so at least 21 days. And the goal is to get that second vaccine within 4 or 5 days of that 21-day interval. But there's no limit. So if someone can't get in by day 25, there's no harm. They still need to schedule that second appointment and get that second dose done as quickly as possible. But we had a number of calls yesterday, folks that couldn't see those appointments, and that was because we didn't have them available. And that overwhelmed our call system. So I guess I would just ask the public to continue to show a little patience as we go through this process. And we will continue to add resources to the call center so that hopefully we can handle that call volume. But as we experienced yesterday when we opened up appointments for folks age 75 and older, appointments yesterday afternoon, today, tomorrow, all filled very quickly. And so, again, the easiest and fastest way I'm sorry, not the easiest necessarily, but the fastest way to get an appointment is to go to the website and schedule through the website. And again, we only make appointments available when we're confident that we have vaccine available to match up with that appointment. And then the other challenge that we've experienced is there are national stories about people who, they call it vaccine surfing, that they may go to a pharmacy or a health clinic of some kind and kind of hang around the back door until the end of the day in hopes of getting one of those leftover doses at the bottom of a vial. Because everybody that's delivering vaccine knows how precious this vaccine is. And so we schedule appointments in the lot of, to match the doses that we have available in a particular vial. And things happen. Somebody may not be able to make an appointment. So at the end of the day, we may open a vial, have 6 doses in it, and we've only got 4 people left with appointments. And so we'll dispense those 4. And we do not have a standby list. We don't have a way for people to call and get on a standby list. We do have a process in place that allows us to make sure that we don't waste any vaccines. And it's tied to folks that are in phase 2, primarily that work in public safety roles, that can get to the vaccine site within about 20 minutes, and then we'll dispense whatever's left in that vial. But there is no standby list that people can call in and get signed up on. And so I want to make sure that people don't waste any time trying to call in for that particular purpose. Going forward, we've got...
Tim, can I interrupt
Sure.
for a second? Okay. So a vial has 6 doses in it, and so the most we'd ever have at the end of a session is you'd open up a vial for all 6 people, and if only 1 showed up, you'd have 5 extra.
Correct.
So people are thinking we might have a lot. 5 would be the most if. And then from there, then we're making phone calls to the managers of public safety to say, hey, do you have somebody? And then they can get down there in 20 minutes.
Exactly.
So, okay.
Yeah.
But thank you. Got another question or comment? Commissioner Dennis?
Thank you, Mr. Chairman. I'll have more questions later on, but to follow up on the question that Commissioner Meitzner just asked, and I'm going to talk about it later on. I did go over and tour the facilities yesterday, and they preload the vials or the syringes, which is a great idea. But I guess it goes back to the answer you just gave about we're not going to get down to the point where we're going to waste any because we're down to like 6 doses in a vial, but they're preloading hundreds of the syringes. So how do you program that so that it gets to the end because of the number of preloaded syringes?
That's why we do appointments. And so we've got staff throughout the course of the day that are tracking appointment. We know how many appointments we have available in the day, and then we've got staff that are tracking how many missed appointments there may be. But as they get towards that last hour of the day, they preload a lot fewer doses than they would in the middle of the day as well.
Very good. And don't get me wrong, I think you're doing it exactly the right way. I'm not criticizing that at all. I want to make sure that we don't have a bunch of preloaded syringes at the end of the day.
Commissioner, I think you were there pretty early in the day, right around, were you there at noon or a little bit thereafter?
I was there at about 2:30 or 3. Yeah.
So we went to, 7 last
7,
night, Tim?
yeah.
So you go there about 6 o'clock, that preloaded syringe number would be down to just a few.
Okay.
So.
Very good. Thank you, Tim.
Sure.
Continue.
So, looking forward, we are in the process of communicating with partners on what's called distribution. So with vaccines, there's 2 different processes. One is dispensing, and that's getting the vaccine into somebody's arm, and that's what we've focused our efforts on right now, is on dispensing. And then distribution is getting vaccine to other dispensers. And so right now the state distributes vaccine to us. We will get to the point where, as additional vaccine becomes available, to the point where we're not going to be able to manage all of it through our processes, we will distribute to our partners and have them do some dispensing on our behalf. And so we're in the process of having those communications with folks. Adrian and I and a number of staff are doing a call with a number of different pharmacies today to talk about what their interest is, what their capacity is, and then talk to them about the benefit and the value of them following the same schedule that we're on. And so
Okay.
we'll have those conversations. And so it's not that far off into the future where we'll be distributing vaccine to other partners to dispense as well.
Okay, thank you for that news. Commissioner Howell?
Thank you, Mr. Chairman. Just, I'm curious, do we have a list of all the places in the community that are actually providing the vaccine? I know we mentioned VA, I know the hospitals have some, but what about the some of the clinics like Grace Med? And I think, if I understand correctly, I believe Health Corps is also doing some. Do we have a comprehensive list of all the places that are doing vaccine?
We have we have two lists. One is the list of the entities that have been approved by KDHE to dispense and that have received vaccine. That's a really short list, and that's us and Health Corps and GraceMed. And then we also have a list of the people that have applied to KDHE to be dispensers, and those are the folks that we'll be talking to in the coming weeks to figure out what makes sense for them to help us with the dispensing process. So we've got those two different lists.
It was a little bit confusing, but there was a news story that came out a week ago or so that talked about places like Dillon's doing some of these. I don't think they've actually ever received any vaccine. They may be somewhere in the process of trying to get approval, but they're not there yet.
Dillon should receive, the Dillon stores in Kansas, and so that a national story again that talks about utilizing pharmacies in large-scale retail pharmacies, and in Kansas they're working initially with the Kroger, the Dillon stores, and the 11th they should receive some vaccine, a very limited number of doses, and that's coming outside of the state channel. That's going to be a direct shipment from the feds to those, depending on which state you're in, which pharmacy will get those. That's another example of a pharmacy that we're going to work with to talk about maybe increasing their capacity through additional vaccine that we receive through the distribution process.
Was there one of these organizations doing a drive-through at the Wichita State University that we know of?
Not that I'm aware of. At this, it's possible, but there's not that I'm aware of.
I had a couple of questions I wanted to ask on behalf of some constituents that contacted me. I think they're good questions. Let me go ahead and ask them. There may be a number of people out there that received the first dose, and we have a second dose essentially earmarked for that same person. I don't know I don't know how long we hold on to that dose, but if they choose not to get the second dose, when do we make the choice to go ahead and give that to someone else?
Well, what we think that we're going to see is that we will receive a shipment that comes 21 days, roughly 21 days, 3 weeks after the first dose, that matches the volume that we received 3 weeks ago. And so we'll have that dose available, and if we can tell maybe 2 weeks afterwards that we haven't used all of those doses, then we're going to turn that into a first dose for someone else. We know that there will be some people that choose not to get that second dose. We encourage everybody to get the second dose. The efficacy of the vaccine goes way up when you get that second dose, but we know some people won't, and so we're going to track our inventory, and when our inventory appears that we're not going to need to get that second dose to someone, we'll move it into a first dose option.
So the second question I had from a constituent said, is there anything that, if people want to people want to volunteer to help, is there anything the public can do to assist in expediting this process of getting the vaccines out to people?
We can always use more volunteers, particularly if they are licensed in such a way that they're able to give shots. And if they would go to the health department website and look for the MRC, the Medical Reserve Corps link, and go through that process, we'd be delighted to have them participate.
Do you need other volunteers for like managing traffic flows or other opportunities?
Anyone that wants to help can volunteer through that Medical Reserve Corps link.
I had one call yesterday that was concerned. They said that they believe that the states that have received more vaccine, the reason that they're receiving more vaccine is they're pouring through it very, very quickly. They don't have anything stockpiled. They go through it as soon as they get it. And I guess my question would be, you talked about we have 1,100 appointments today, and I assume that's for both the drive-through and for Intrust Bank Arena. That's a fairly low number. I know we had targeted at least 2,000 a day. That's good. So I understand the cold is a challenge, and I'm not going to I don't want to be uncaring about that. I think it's a very real problem. But I think even at 2,000 a day, I think we still have quite a bit of vaccine available. And in fact, I noticed I was able to get some information that looks to me like there was actually open appointments almost every single day last week. We didn't actually have all the appointments filled. And I guess I'd like to know, the faster we get this vaccine out of our hands and into the arms of people, I think the better that we can ask for more. But it's hard to ask for more when we have some in our hands it's not being administered. So I guess I would just like to let you know I'm not personally happy that we're only doing 1,100 today. I know it's challenging, but I wish we were doing 5,000 a day. I don't know how to get there, and I would rather get it in the arms of people as quickly as possible. And I think even at 2,000 a day, that's just not very fast compared to the population size we have. And it's hard to ask for more vaccine if we don't get that out there quickly. Then we're losing the argument, I guess, to say we need more. And other places that are getting more, seems like that's what they're doing. So I don't know what we can do to speed this up a little bit.
That's almost like a chicken and the egg scenario. We staff and we ramp up to the level of vaccine that we've been given. I think if we could obtain more vaccine, we have capacity to ramp up more through a couple mechanisms. I think the county mega site could do more. And then I think what Tim has alluded to, using community partners, we have tremendous capacity in this community to give vaccines. I've been watching stockpile, if that's what we're going to call it, and it's around 17,000 doses. But when you're running 11, 12, 1,500 vaccines per day, 6 days a week, that doesn't last very long. And we have to make sure that we have enough for all appointments given. I think once we begin to receive more vaccines, we have tremendous ramp-up capacity. I wanted to add in, just on a whole nother subject matter, I've had conversation with Dillon's, Costco, and Walmart this week, and all three of them confirmed they are getting some vaccines in, though very limited. Dillon's, I talked with Sheila yesterday. They are thinking they're going to get 1,000 doses a week, and they've got to split that up amongst many stores. So they're looking at maybe 100 vaccines per store, which is not that many. But they also don't have a tremendous capacity there like we do at the mega site to give hundreds of shots a day. They have capacity of 30, 40, 50 shots per day. But if you multiply that by 10 stores, it's significant. And they are willing to take more from us, and they commit that if they take more from us, they will adhere to the county plan of if we're at 75 or if we're at 70 or wherever we're at, they will administer those vaccines as per county request. So we have a lot of capacity here that I think we would be glad to push if we knew we could start getting more vaccines. But if you create a huge capacity and you don't have anything for people to do, that's almost as bad. So the other thing I was going to say to chime in on what people could do to help, I think our messaging is for us to kind of fight human nature somehow. And if you have an appointment, please keep it. Show up in a timely fashion. If you have an appointment, please get your second vaccine. That we're running into a little bit of trouble, people not scheduling for second vaccines. So those normal human nature kinds of things, we really are asking people to be cooperative and patient with that. We also, and I don't know how much Tim wants to get into it, but with our phone situation yesterday, a lot of people are calling that number for general information. That is a scheduling line. And so when we have to deal with people calling for general information, it takes time up. It keeps people from getting into the call center to schedule an appointment. So just try to be judicious and work with the county on what we're trying to pull off here, which is a monumental task to give vaccines to everybody. We have a population, 370,000 to 400,000 people that are eligible, and not just one vaccine. We got to get you 2 shots. It's a Herculean effort out there. So to be patient and to, if you can get online to get your appointments, let's try to keep the phone use to a minimum. Understanding we have some people in the community that have no access to computers, so they need that phone line. So it should be reserved for them. So that's the kind of thing, Commissioner. I think if you could put that message out, would be good.
I actually saw a news story yesterday that I thought was very interesting. In fact, I saw 2 news stories. I thought they were both similar to each other. One news story talked about in some other community how some couple, some family got involved in helping seniors schedule their appointments.
Yeah.
What a great service that was. And then one of the news stories here locally said that, again, maybe you should comment on this as well, but said that if somebody wants to provide that assistance to someone who's doesn't have access to a computer, we welcome that. That somebody else can do that on their behalf, as long as they put in the person that's supposed to receive the dose, put their name in and their birth date or whatever it is that's required. That somebody could assist them on someone else's computer, they could provide that service. Is that still true?
Oh, absolutely. I've heard countless anecdotes of adult children who've done the registration process for their parents or for their neighbors, that sort of thing. So absolutely, we encourage that. Again, from an efficiency standpoint, folks that can do that appointment registration through the website, it's much more efficient for everyone involved. And so if someone's available to do that for others, that's a great service.
The only tricky piece to that is you get a confirmation email. So whoever does that enrolling, it's very important that confirmation email get to the person who gets the shot so that they show up on a time. So if you're going to do it for a group of neighbors or a group of people, unless that senior citizen has an email address, which would be the best option because that email would then go directly to them for confirmation. But if they do not, that confirmation is going to come back to you, and then you would need to call and make sure that they get their time. That's the only tricky part of scheduling for other people. But it's definitely something we should promote.
I have a couple more questions and comments, but I know I've been talking a while, so may I continue, Mr. Chairman?
Sure.
Okay. I guess I would like to ask, if our goal is to get this out as quickly as possible, and we're trying to use our own staff to get there, and we're somewhat limited, meaning we can't just go from 0 to 100 miles an hour and back to 0 quickly, and that's what I think would happen if we simply put the gas on until we ran out of gas. I guess I would like to see, could we get into the private sector and incentivize the private sector to be I know we talk about our partners and GraceMed and Health Corps, but I guess I'm asking about if there's a doctor's office that wants to convert to be a partner, we would actually pay them essentially to get involved in this to help us. I think we ought to be talking about using the private sector somewhat.
Well, we absolutely are. I mean, I talked about pharmacies. We're also engaging, we're going to start with pharmacies, but we're also engaging with other medical providers. There's a process that healthcare providers can go through to apply to KDHE to be a dispenser, and those are the folks that we're going to work with. And so if they've done that, we know who they are, and we've made contact with them so that we can understand their capacity and what their desire is. So we're making those contacts already.
Okay, and then I'll try to wrap up my comment here. I would say also that I feel like I've mentioned this numerous times. I'll say it again. I think it's important. I had a conversation twice yesterday with two people who called me. Same question. Actually, 3 yesterday. There's people that are not qualified by age, but they have enormous health problems. And I think that if anybody would listen to their story would say, man, they need a shot. Get them that shot. I wish that we could have a prescription process. The doctor would give them a way to get to the front of the line based on health challenges. They're not age qualified, but they've got a number of things that says that they are very, very fragile. They need to get to the front of that line. And I think we need to, again, we talk about it, but I'm just going to ask for it once again to get a prescription process where people can do that.
We're hearing you, Commissioner, and it's not just you. Other commissioners are being asked the same thing. And I'll just remind commissioners that in the CDC plan, I don't have it in front of me, but ages 18 through 59 with comorbidity conditions are actually phase 3 in the CDC plan. What Dr. Mintz has talked about, and he did very early on, was what you're alluding to and suggesting is that we somehow, through a mechanism with doctors' offices, create an environment where people that meet that kind of serious health issue can basically get a shot in phase 2. I think we continue that conversation with Dr. Mintz, especially as we get lower, we get past the 70-year-olds and look at a way to work with physicians groups around town and get those kinds of vulnerable people in. But recognize, Commissioner, and you all know this, no matter what we opt to do here, we're going to get criticized because now you're taking what are phase 3 clients in the CDC standard and moving them up to a phase 2, and not only moving them up to a phase 2, but maybe jumping people in a phase 2. So you will have that group in phase 2 who will not necessarily be happy with that decision, but I think Dr. Menz is used to criticism, and he'll do what's best for people and for the health of this community. And the goal is, and there's three things: try to stop the death, try to stop the hospitalizations, and try to stop the virus. I mean, try to stop the spread of this virus as fast as possible. And he strategically is trying to think and hit all three of those items with a limited vaccine supply. So we're hearing you. We talked with Dr. Menz about it. We're going to continue to talk with him about it. And at the end of the day, he will come in and we will present to commissioners, the Board of Health. If that is the decision that he makes or he thinks that's best, he will present that to you.
I appreciate that. And let me just say this again, that I think comorbidities is a very broad term. And I think someone who has managing their diabetes may the same person as who's dealing with stage 4 cancer.
Yeah.
That's lost their immune system.
That's part of the challenge.
If someone
there is
has
that
organ
definition.
failure in their organ donor list, if someone, there's a list of these types of people. I think anybody would say if you're 50 years old and you've got that type of a situation, you really need to have some special handling here. I think I feel like it's a little bit of common sense here, and I don't know why. I don't know how to codify what I'm saying here. But I do think that when you hear that story, everybody would say, yeah, that makes a lot of sense. That person should go to the front of the line. Mm-hmm. So anyway, I just want to ask for it once again. I've got to advocate for the people who are calling me. This is a never-ending discussion. Every day I get phone calls like this. So I just want to ask for, let's just not talk about it. Let's find a way to get there. And I hope my colleagues are with me on this. I don't know if they are or not. And then finally, my final comment would be this. You mentioned we have 17,000 doses in stock. We've only done 24,000 doses since the beginning of this. So we're talking, that's roughly 40% of everything we've ever received is still in our hands. Well, I think we can do, my opinion is, that actually bothers me. I would like to run out of vaccine and then say we need more. I want to get it in the arms of people so fast that we actually run out. That ought to be our goal. Let's get it out.
Comments to that very quickly. We are now in our third week where we have consistently received a vaccine dose. So when we talk about to the beginning of time on vaccines, which is right before Christmas, finally, in the last 3 weeks, this week, we are receiving what is now appears to be a consistent amount of Pfizer coming in. So we'll react to this. I mean, we just, up to 3 weeks ago, we didn't know when we were going to get any. And things are getting, as we predicted, things will get better every day with vaccinations. We anticipate that there'll be more volume coming. And to your point, if we run out of vaccines, I think we'll get criticized for that too. I think people expect us to have some small stockpile, so if they need a second shot, that they can get it. I hear what you're saying, and I know Adrian's goal, and I think she's on the phone here too, but Adrian's goal, the health department's goal, is when they get vaccine, that within 7 to 10 days, that vaccine is gone. That vaccine is in an arm, out in the community, and we just continue to roll through. And I was talking to someone else describing this stockpile. When you received a group of 7,200, it's like your checkbook at home. When you get paid, you got a lot of money. As you go through the 2 weeks or the week, you don't have so much money anymore. It's going to be that way with vaccines. We have a lot come in, we shoot it through our arms, and we hopefully get a lot more, and we just continue this cycle. So we'll never have zero. We'll always have some working supply. I hear your point, Commissioner. You want that to be the smallest number possible, and I get that.
Okay. Commissioner Lopez?
Thank you so much for being here again. So I do agree with Commissioner Howell on the comorbidities. I know that logistically is going to be an extremely hard challenge to determine who qualifies for that and who wouldn't. And so, working through that, I would like to also see someone who's younger than 65 who is going through chemo and does have a higher risk of, not making it if they caught COVID, being moved up. So however that could happen, I mean, I would be in favor of that. I do have a couple of questions though. When we are talking about that process, is that something that the state level is looking at too, or is that something just our county is looking? Have we heard if Johnson County or any of the other large counties are also thinking about that possibility of moving those people up?
I have to assume that the state considered all of that when they developed their initial schedule and the phases. And I'm sure that they're hearing the same types of conversations that we all think about. And again, in individual cases, absolutely, there's some incredibly compelling stories that we hear routinely. And so I'm sure that the state's also hearing those same types of stories.
Okay, and then I also had a question about volunteers because I heard from many people about the phone issue yesterday. So if people want to volunteer to answer phone calls, then they can go to the website under, I think I wrote it down. What did you say?
Medical Reserve Corps.
Medical reserves, yep. If they can go there and sign up to volunteer for phones. Would it be helpful if we had people who could almost be translators or who could speak other languages volunteer? Would that be something that we could use as well?
I think we're always, the more folks we have that are able to speak more than one language, the better off we are.
Okay. And then when it comes to getting rides for some people that might need more help that are in these older age groups, is our Department of Aging, I know they have where they can set up rides if you call 24 hours in advance anyway. Are they working with us to get rides for people to get their vaccines?
Absolutely.
Okay, perfect. And then if people are calling the number we have out for scheduling for general information, if they would like to call for general information, is there a better number that they can call that we can tell them to
The
use?
1022 line is the general
That's the one,
information
okay,
line, yeah.
perfect.
Okay, Commissioner Dennis?
Thank you, Mr. Chairman, I appreciate it. And actually, I was going to wait until you finished your briefing before I asked questions, but it looks like now it's time to ask questions. And so I think one of my questions is going to be touched on here later on in the briefing, but let me hit a couple things real quick. First of all, I went over and toured both the drive-through and Intrust Bank Arena yesterday, and I want to commend each and every one of the folks that are working at both those facilities. They're working very hard, especially the people that were out there with the drive-through. It was bitterly cold. They are indoors, but the indoors is nothing more than a large, huge, open high bay that you drive buses through. So they do have some heaters in there, but you got to be right next to the heater to feel any warmth because the rest of the facility is like 10 degrees. So I want to thank them. I went over to Intrust Bank Arena then following that, and the getting in and the processing and so forth is very smooth. One of the questions, and I asked a ton of questions at both facilities, and the folks did a great job answering the questions. But one of the questions I asked at the Intrust Bank Arena is, could we go to 3,000 or 4,000 a day over there? And they didn't seem to think that we could get past 2,000 a day at the Intrust Bank Arena, at least the way that we're configured right now. And I don't know if we changed anything, whether we could go beyond that or not. So I would hope the future holds that we're going to be able to do 3,000 or 4,000 or 5,000 a day because we've got 350, 400,000 people to give a vaccine to, and we won't finish in anytime soon if we don't have a larger capacity. So I don't know what the future holds. What are you looking at for us to be able to get to 5,000, 6,000, 7,000 a day?
Well, if we were going to do that number, we would probably have to do a large part of it outdoors, and so that's going to be weather dependent as well. Right now, we are looking at an alternative site that would do two things for us. We think it would give us more capacity for vaccinators, and the other thing that it would do is it would give us a permanent location so that we wouldn't have to break down and set back up based on the Intrust Bank Arena schedule, and so we're pretty close to that.
But Tim, when you say alternate site, you're talking about no longer using the Intrust Bank Arena, and that does not expand our capacity to go to these higher rates that I'm talking about. We need to have a plan in place that we're able to do. Let's shoot for 10,000 a day. I don't care. I don't know if we'll ever get that many vaccines, but how with the plan that we have, are we going to get to those areas? Because, as I said yesterday, they didn't think that they were even going to get to 3,000 a day at the arena.
Well, one of the limitations that we have, and some of it I was going to touch on in resource allocations, but one of the limitations that we have is the number of vaccinators that we have, and so that's why we continue to recruit more. and then we've got a vaccine limitation, and then we believe that we could get to a higher volume, and we're just going to have to continue to refine our processes and work through processes. But I think that 3,000 probably is a possibility if we get enough vaccinators. And so we work with a number of different temp services. There are folks who don't want to do this type of work because of the transmissibility of COVID, and so there are people who are qualified to do the work that don't want to do this kind of work. And so that's why we also continue to look for volunteers that are willing to do that. So we're working constantly to increase capacity, and hopefully we'll get to a point where we have excess capacity to deliver vaccines more than we have vaccine. And right now we're generally able to get through our allocation in that week's time. We're trying to do that within 7 days. If we were doing 4,000 or 5,000 a day, my fear is that we would be open for vaccines for a couple of days, and then we would have to shut down because we went through our vaccines, and then we'd receive criticism for that as well.
Let me follow up on that, because I received the question now twice. People seem to think that because of the low number of vaccinations that we're giving, that the state is throttling the number that they're giving us. And I keep telling them that that's not true. We're taking anything that they can give us. Is there some kind of a mechanism where that they look at how many vaccines that we're giving and then throttle back the number that they provide us?
We have an opportunity to if that were a concern, we're able to talk to the folks that are making those allocation decisions and make sure they understand what we're doing. I think the state recognizes that we're vaccinating a lot of folks, and again, their ask is that we get through the vaccines that we receive in 7 days, and so we continue to be able to do that. So we haven't seen or heard any recommendation that we receive fewer vaccines.
We'll ask that question of the state, though, Commissioner. We'll ask that question directly to them, to Marcy.
And the second part of that question is, you read the newspaper today, it says we're 49th in the nation on the number of vaccines that we're giving. Is the federal government then doing the same thing or the possibility that they're doing that? Are they throttling the numbers that are coming to us because we're 49th in the nation? So it's kind of a two-part question.
Marcy was on KWCH last night talking about that very question, and her response was similar to the response we've been hearing from the state for a month or so. It's not necessarily, it's about data entry at this point, that they're lagging behind and they're finding pockets where they're missing the data. And she is convinced, at least she said on the TV last night, she's convinced that if the data catches up, we will no longer be 49th. She did not comment on whether the federal government was somehow limiting the amount of vaccine coming to the state of Kansas. And to your first point, we've never heard anything contrary to vaccines being allotted to areas based on population. We've never heard anything contrary to that. We know we're an urban center, so we should get, and you and I have talked about this before, we're 18% of the state population. We ought to be getting whatever the state's getting, somewhere roughly 18%, not on the nose every time, but something similar or close to that. We've never heard anything contrary to that. We have tremendous capacity in this community. Tim has already said that at our mega site, we can do 2,000 to 3,000. To your point on the plan, if this increases, I think we then begin to look at our community partners. What can we get from pharmacy? What can we get from Kroger and Walmart and Walgreens? I mean, we can get thousands of vaccines there. And then if we were lucky enough, fortunate enough to receive 15, 20,000 vaccines a day, we open a second mega site. Then the challenge is going to be, as Tim has mentioned, vaccinators. It's going to be people. We're going to run into the same problem we talked about all through COVID. There's only so many healthcare professionals that can provide that individual kind of service. So our limitation, our ceiling, so to speak, isn't necessarily capacity or building, or even if it becomes vaccine, it's going to become a people. It's going to become a human resource issue. So we'll continue to work through this. We have good dialogue going on with doctors' offices, with Ascension, and with our pharmacy partners. And if we are lucky enough to get the vaccine, we have tremendous capacity in this community.
Okay. Well, going back to your statement about what the governor said on its reporting, I have a hard time believing that the state of Kansas is 49th because we don't know how to run computers.
And what, let me clarify, that was not the governor that said that, it was Marcy was on TV. That's her designated point of contact, her chief. They're calling her the COVID chief now at the state of Kansas. It was her that made that comment, so.
But still, there's 49, for 49, there's 48 other states that know how to run a computer better than we do. So that baffles me. Let me hit a couple more of my questions. One of the pieces, first of all, I go on the website each day and I take a look at how many open positions that you've got. And last week I was very concerned because we had a ton of open slots. This morning I went on the website and we don't have any until Saturday. Now, the people that want the vaccine, that's kind of a concern, but it made me feel better because we're filling up those slots that are available. So the piece of information that I need to make sure that I'm able to wrap my head around it and help you all, I need a briefing of some kind of a spreadsheet each day that tells me how many vaccines that you have on hand. I need to know the stockpile. We're not getting that information, and I would love to have that. And then as we get that piece of information, add to it how many doses that we've got scheduled each day so that we know how that stockpile is being drawn down, because I don't have that kind of information. So please help provide those. One other question I have is on assisted living facilities. I know that Sedgwick County hit one assisted living facility and took care of that one. But who is going out looking at the assisted living facilities? Because the long-term care facilities are being taken care of by the federal government through contracts with different pharmacies. But there's no one taking care of the assisted living facilities, and they should be right at the very top of our list. So what is our plan to get into each and every one of those assisted living facilities here in Sedgwick County?
We've made outbound calls to a number of those. Since the very beginning, even back in testing, we've been working with all sorts of different adult care home, and that phrase covers a number of different designations, whether it's skilled nursing to assisted living and the things that are in between. So we've got a call that we do routinely with those folks, and it may be time to do another one, but we're making outbound calls to those entities to work with them to see if they've made connection with their pharmacy that they normally work with, or if they've made connection with one of those national pharmacies, or if we need to work with them. So we've got a unit in the health department that's making those calls.
Sorry about that, somebody was calling. Well, I guess my concern about that is that those pharmacies are not receiving the doses. So for us to call them and say, hey, work with your pharmacy to get the vaccines done, that's exactly backwards of what I would think we would be doing. We've already said we started out with 85 and above. We went to 80 and above. We went to 75 and above. The people that are in these assisted living facilities fit those categories. Sedgwick County needs to figure out and step up and figure out how that we're going to vaccinate the people that are in those facilities. So I need a plan.
Okay.
One of the things that you've got on your briefing is, and I think it's a great idea, scheduling for both appointments with the date for the second appointment. I hope we do that. I've been working with the VA trying to get a vaccine for myself, actually, and so I've got one scheduled for May or April and another one scheduled for May. I know the dates right now for both of my appointments to be able to get a vaccine. I don't know why we can't do that. It would certainly let us know as we're looking at our stockpile and we're looking at the other piece of data that I want on what we've got in the future, so that we know where we're at. So I certainly hope that when you brief that this is something we're looking at. That's most of my questions right now. I'm sure I'll come up with something here again as you get through the rest of your briefing, but,
Let me jump in. First of all, I think we have a plan for assisted living. We'll put that on paper. We're not communicating it very well today, and we'll show you what the written plan is on that, so we'll get that for you, Commissioner. We keep talking about stockpile. We have doses on hand right now that we are planning to vaccinate within 7 to 10 days of receipt. So just so we're clear on, because there are counties in the country that are stockpiling, and then they're going to have a mass vaccination event somewhere in the future. So they're stockpiling tens of thousands of vaccines, and then they're going to roll a mass vaccination process. We are not doing that in the county. Our mission here is to get these vaccines out as soon as possible and to continue to move them. And Tim, I don't know that he was in his part of the presentation yet where he was going to talk about scheduling the second dose upon receipt of the first dose. So let's let him continue with his PowerPoint, Tim, and maybe you can cover that.
So I don't want to get the distribution piece lost again. And so one of the groups that we're talking to about distributing vaccine to so that they can dispense it is pharmacies, because we know that pharmacies have connections. Some pharmacies have connections with different facilities in the community. And so we want to make sure that we get that vaccine into their hands so that they're able to help with the distribution. We're also looking at, in an effort to increase throughput, and one of the things that I'm going to point out is that one of the limiting factors that we have as we vaccinate the number of people is that we're vaccinating people. And so some folks are able to move a little more quickly through the process than others. The first few weeks, as we focused on healthcare workers, we were able to schedule more. We've scaled back some of the scheduling because folks don't move through the process quite as quickly now as they did that first couple of weeks. And we're adjusting as we go. So if we do time studies almost every day to figure out how many people we can get through, and if we recognize that we can handle more appointments, we add appointments throughout the week. And so while it looks like there are no appointments through until Saturday, it's possible that we may add some additional appointments later this week, again, in an effort to get as many people vaccinated as possible. One of the things that we will be moving to now that we believe that we have a consistent flow of vaccine coming into the community is scheduling that second appointment. As people receive their first, they'll schedule for their first appointment, they'll get their first dose, and then at that point in time we'll schedule their second dose for them so that they'll be able to get back within that optimum time range. And we should be doing that hopefully as early as next week. And I think by the end of the day, we'll be scheduling for second doses for phase 2. Again, we've got people that are coming up on that 21-day anniversary. The recommendation from the manufacturer that was approved is that there be at least 21 days between doses, and so we want to get folks in as soon after that 21st day as we can, and so we'll start scheduling those appointments now. And I think based on the questions, we've covered almost everything else that I was going to add, so if there are more questions, I'll be glad to try and respond.
Commissioner Lopez?
I do have a question on what the holdup is and why we're the 49th state, or why it's saying that we are. Do we know where that holdup is? I'm sure it's just like data entry. Is that at the local level where we're not getting it to KDHE daily, or is it KDHE not getting it to the federal, or what? Where is that?
She made it sound on the news last night that she is finding, and remember, she's only been on the job for a couple of weeks, so she's still getting her sea legs under. She made it sound like there are pockets in the state where they were not receiving data information, and she mentioned hospitals, for example. Mm-hmm. Some of the hospitals, and there's a ton of vaccinations going on at the hospitals in phase 1, that data did not, they're just now finding that and putting that into the state systems. So she made it sound like there's pockets of information, pockets of data out in the state that didn't get reported, that they are now going backwards and getting reported. This is my take of what she said on the news last night. I'm wondering, I don't know what her availability would be, but I wonder if we couldn't get her to agree to maybe talk to the Board of Health on a conference call or something, and you guys could ask, we could ask state level questions in that arena. Let me see what the potential is to get state level people on a call where we can answer these kinds of questions.
Oh, that would be fantastic if she would be willing to do that. Can you explain how we're determining how many people fit into each of these groups, like 75 and above? I've had that question asked many times, and I believe I have the right answer, but I want to make sure that I'm fully aware.
So I got my data on demographics from the planning department, Metropolitan Area Planning Department, and those are 2018 numbers. I think Kate has gotten some numbers from the epidemiologists at Health that are 2019 numbers. They're very close, but there is a few differences. So between those two sources, I think that's the best we can do. Stephen Banks told me in the planning department that the 2020 census data will not be out till July, and of course, we're needing these numbers now.
Right.
So we've got ballpark figures of population groups within phase 2, and we've got it broken down by age and occupation as best we can. And then, as I mentioned last week, we're trying to create this modeling to show, using those numbers, how long this is going to take based on the amount of input of vaccine coming in yet. So, but we can get you the demographic numbers at least. We just don't have it into a working model yet.
Okay. Do we have any idea when we might start receiving more than the 7,000 a week? Have we heard anything about that?
No.
No, okay. I guess as we get through 65 and older, when will we start having those discussions on the next groups to go in phase 2? I mean, I know I've had that question so many times, and really in the rest of phase 2, who's going to go next and how that's going to work?
We're having those discussions now. We've already had those discussions, and we're working with Dr. Minns again. We're using information guidance from CDC as we develop our local plan and modify our local plan to fit our work. Much of phase 2 is based on workforce, and so our workforce looks a little bit different than the typical CDC sample workforce, and so
Sure.
we'll adjust a little bit from there. But
I would really like to advocate for our teachers as they're going back in person schooling. I don't know I'm sure we have talked to the nurses at our schools to see if they would be willing to help vaccinate their teachers, but I do think if we want to keep our schools open as safe as possible, that we need to make sure our teachers are at the top of that list.
I do want to confirm with Dr. Minns, but when we get to, and Tim can correct me if I misstate here, when we get to under 65s, it's my understanding that public safety and teachers are the first up in occupation-based phase 2. Now, the rest of this, I think, to Tim's point, we're having discussion with Dr. Minns, and once I do agree that needs to be settled, even though we're probably weeks off from having to address that. I think the sooner we get that information out, the better. So we will talk with Dr. Minns about that and hopefully have something within a few days on how the rest of phase 2 is going to look. Just tempering everybody's expectation. So we opened to 75 and above this week. That's another 10,000 people that became eligible for vaccination. When we go to 70, that will be about another 17,000 eligible for vaccination. And when you get into the 60s, that number goes up a lot. So we're a ways out, I think. If the strategy of the commission and the strategy of the county is to vaccinate elderly first, we're several weeks out from going to occupation-based vaccinations.
Yeah, absolutely. I completely understand. I think just kind of being able to answer those questions a little bit more and what that could look like will help, with the stress of this. And the last thing I have is just, I understand that there's so many frustrations with this process and, just with COVID in general, but I mean, our health department has really gone above and beyond in so many ways. And while I understand, people are frustrated with certain things, I mean, we really need to make sure that we are not taking that out on the health department because they have gone above and beyond over the last year, and they really deserve our support and our respect. So just to throw that out there. Thank you.
Thank you for saying that.
Thanks, Commissioner, also for saying that. And we do have a team of people working on this. It's not like it's one person in a room. We have a group of people. It's a think tank. And we're not unique in Sedgwick County. This is going on around the country. People are trying to read and react this as best they can, and our health department does a tremendous job. This group, this team, this army of people that is looking at this situation that's unfolding in front of them, their read and react is very well. They are performing exceptionally.
I agree. Thank you.
And Commissioner Dennis?
One last thing, going back to my visit to the drive-through, I am kind of worried about our folks that are over there at the drive-through. We look at the forecast for the next week and a half, and it's getting worse every single day. And I don't know if, safety-wise for our people, if we need to continue with that drive-through until the weather gets better, because I do have some concerns about their safety over there.
I agree with you, Commissioner. One of the things we did yesterday was we up until now, as we've done drive-through, we've scheduled the full time period that we're open from 10 in the morning until 7 o'clock at night generally. We are alternating hours for appointments, and so we've got an hour of appointments, and then we've got an hour with no appointments to give that staff that you described as standing kind of out in a concrete barn, and we close the door so the wind's not blowing, but it's still 13, 15 degrees. So they're able to go into the office area and warm up a bit. If we learn over the next couple of days that's not sufficient, we'll either scale back appointments or we will shut it down, because we've got to keep our staff safe. I agree with you.
And I understand the drive-through is for 80 and above. We didn't drop that to 75. Is that true?
It should be 75 and above.
It is?
as well.
Okay.
It's for 75 and above.
At what point do we say that we don't need a drive-through anymore? At what age level?
We're monitoring the folks that come through the drive-through, and one of the things that we have to keep it available is for second shots, because we know that we serve people that were 90 and above in that manner, and so we'll need to get them through a second shot. So we think that we're probably 3 to 6 weeks away from removing that as a scheduling option. And then that, again, pulls more vaccinators into the high volume setting so that we can, again, increase the number of folks that we're doing throughput on at Intrust Bank at our high volume site.
We had that conversation. I'm glad you bring that up, Commissioner. Tim and I had this very conversation on Monday when we were looking at the weather forecast. And we'd even talked about, because right now our vaccination group is elderly, because that's important. And we had talked about maybe we move to another part of phase 2 during this cold snap, but our elderly want this shot, and they are filling appointments. And I think to shut down the drive-through, and I think our staff understands this too, which is why we just can't brag on them enough. They understand the need and who we're serving right now. And for us to shut down the drive-through I don't think was an option to them, because they know this need is out there. So we'll do the best we can to keep them safe and to alternate. But I think that the staff sees the need that this population of people wants and needs this vaccine.
Very good. Thank you, Mr. Chairman.
Okay. I don't see other comments. My brief, a lot have been said. You can tell the commission has a lot of emotion. I as well have received an incredible number of calls and emails, and a little bit of yesterday. I would just encourage, it seemed like we had a tough collision of, as our 21-day cycle was hitting, it's the same day on a Monday that we announced that 75 and over, so there was just an overwhelming amount of traffic coming at our phone system and our website. But I would encourage the public. I tell you, I was on a call yesterday afternoon, and very, very emotionally and serious about the website not being able to make an appointment. And so on the phone, I got on the website right then and acted like I was 75 and got an appointment for today. And I had to cancel it because I'm not 75, but I got a confirmation, and actually this morning I got a text that says your appointment is at 6:45 tonight. So I would strongly encourage the public, especially as the age is getting reduced, or if you've got a friend that knows how to use a computer, that if you go, and it took me about 35, 40 seconds to get that done. It is incredibly easy and confirmed and a choice. And again, I had no idea that I would get a text message this morning that my appointment is tonight. And so I would just comment that, and I thank everything that's going on with what the health department's trying to do. It's a moving target. I think these numbers they change every day, and so it's really hard to quote a number as of this day and then hang your hat on it when the numbers are changing all the time. So anyway, I don't have any other comments. I don't know if any other commissioners have any, but thanks for all of your, it does seem that the commission, I've noted that, myself included, that when Dr. Mins talked about potentially the future is, if your own medical doctor says you need a vaccine, instead of us determining if that person needs it or not, if we have a mechanism where the medical doctor just has a separate sign up that says I've got this patient and they need to do it. He mentioned that before, but said it wasn't ready for prime time, and maybe based on the number of calls and items that we have as a commission, I think you're hearing all four of us, and I assume Commissioner Cruz would be the same, to encourage I don't know how many that would be. It may not be that many. It may be just some people that are really serious and emotional that are calling us saying, hey, I've got a problem, but I'm 3 years out from getting it, and right now I encourage those to go back to your doctor and try to work with the doctor. But if that step is close, I think the commission in
there's a couple
general
of
would be
ways we could solve
supportive.
that. First of all, the definition part of that, is Commissioner Howell brought up before, is very defining exactly who that population is. And then I think the hope is that we can, as we begin to get more vaccines, that we can put some of those vaccines in those doctors' offices, county vaccines into those doctors' offices, and have them
Right.
do those
Well, maybe that's-
populations
yeah.
as best they can. We'll continue to dialogue that with Dr. Mins and report back to the commission on that.
Okay.
The only other thing I wanted to bring up, I don't know if Tim, maybe you have mentioned it already, at our testing site at Extension, our numbers are going down there, and I'm not sure, I can't answer why we're doing less tests, but we do have some staff over there that will look to redirect into this vaccination process, which will also help some of the vaccinator problem that Tim brought up. So we'll continue to look at internal resources within the county to help with this as well. We have EMS and fire people that can give shots as well. So we have tremendous capacity. The thing that I think I've heard today that's most concerning is if anybody's getting any information that the state of Kansas is holding up vaccines for us because we don't seem to have capacity, that needs to be argued. We have tremendous capacity in this community, and if we get vaccines, we're going to get them rolled out. So please let us know if you hear that kind of thing.
Okay, Commissioner Howell.
Thank you. Just some final comments. Thank you for your patience and all the questions of today. You're doing a good job. Back to what Commissioner Dennis was saying earlier, I do see that the community's needs and our needs are almost exactly opposite of each other. I mean, to the extent that our staff is struggling with the coldness, and absolutely, I'm very sympathetic to that. I wouldn't want to be in their shoes today. It's also probably better for someone in that age group to actually go through a drive-through versus have to park and walk into the Intrust Bank Arena. So our needs are probably exactly opposite what the community would prefer. It's better for them to sit in their car than it is for them to park and walk in. So I know it's challenging, and I don't know what to do to solve the problem. I appreciate the leadership, to be sensitive to that. Obviously, we want to protect our staff, and whatever we can do to do this safely. I think the drive-through is still very, very important. I don't want to see it go away because of the coldness. I think if we could mitigate the cold, that might be a better option if possible. I don't know if we can rent more heaters and that type of thing. I just don't know what the right answer is. Maybe some warm weather gear would be reasonable if we can find that.
Remind you, Commissioner, you promised me spring weather about 2 weeks ago. You're not coming.
I did not do that. I wish that was true, but no, I'm sorry. I'm afraid that's not true. I do want to just also, express my appreciation to other staff. I heard this morning about a house fire here in Wichita area, and I remember seeing years ago a structure that was on fire that was actually part of our family, and it was very cold weather like this, and it turned into an ice castle. It was just incredible to see the aftermath of that fire. But staff that's dealing with a house fire today, we have firefighters that are out there. We have EMS. We have, not to forget, Public Works very much involved. We have sheriff's deputies out there that are doing this. And so we have got a lot of staff that are out there dealing with this cold weather. I want to just let them know we're aware of them doing this. We appreciate what they're doing, and we know it's hard. And I want to let them know that we appreciate what they're doing. And in the private sector, there's a lot of folks out there in the private sector that are out there as well, especially if you think about the military. They have to deal with this. And so there's a lot of folks out there dealing with the cold weather, and I just want to say that, this is a tough time for a lot of people. On the testing, it's interesting. I've been doing personal testing of COVID-19. I was qualified through the MDL lab to do that. I've provided about 200 tests roughly. And at the beginning, I would say about 75% of those tests came back positive. The requests that I've received personally have actually dropped off also. I'm only doing maybe 1 or 2 a day on average. But I have not had a positive test from anybody in weeks, which is interesting to me. And I was wondering about the cycle threshold. This made the news a few weeks ago. They said on January the 6th that the CDC put out a request to change the cycle threshold of the test sites for PCR testing. And they lowered it down from like around 42 to 40, it was like 42 to 45, lowered that down to in the 30s. Can we validate that? Because I would like to know if that's actually a truth that we can understand, because I think that might change the number of positives that we're seeing. I also have a story I would like to relate that someone contacted me. And by the way, so back on that point, it's interesting to me that, again, I was receiving the vast majority of the tests I was providing were positive before, and now they're just not. So and these are people who have classic symptoms of COVID. So I'm scratching my head a little bit on this so I'd like to know more about that. I had someone contact me a couple days ago that asked for a COVID test, and I was going to provide that, but then his employer said for him to go to one of the hospitals. I think he went to Via Christi. And when he was tested, I believe that he was positive, and so they asked questions about the family. The hospital staff there told him, now I can ask him to validate this because maybe I misunderstood this a little bit, but they told him that because he has a wife and 2 children that they were going to assume that they were also positive. Now, I don't know what that means. They didn't actually get tested, but yet they made the assumption that they were positive, and he was under the impression they were going to add that into the numbers. So I don't know if that happens, but I would like to know more about that. Is there anybody making assumptions about positivity without being actually tested? It's interesting, after that happened, his family, his wife and 2 children did get tested, and they came back negative. I think his doctor somehow was able to get him a test. And they were not positive. So I don't know how that happened, but again, maybe this is that cycle threshold thing again. So I don't know. And then I had someone else contact me. They said, we don't really have a sense of this community in terms of how many people want to get the vaccine. We know how many people live here. We know how many people are clamoring to get the vaccine this week or this, that are kind of trying to get into that line. But we don't actually have a good sense of what their total population is that wants to be vaccinated. So they're recommending we would actually have a pre-registration portal. People could actually get on there and, if you will, maybe say, I'm not scheduling an appointment yet, but let us know they're interested in getting the vaccine. Maybe a pre-registration to that. I don't know if that makes sense or not, but I think that to the point, we don't really know what the number of people is that want to be vaccinated is. We don't know what percentage we are. You said about 8% of our population has been vaccinated. The reality is it may be much higher than that when you think about the number of people who are willing to be vaccinated or want to be vaccinated. Maybe that's 20%. We don't know. But it'd be nice to know what the population is we're trying to get that vaccine to. So those are some final comments. And again, I just want to say thank you for all the questions and answers, and appreciate what you're doing for our community. Thank you, Tim.
Sure. A couple of thoughts about that. One is that our partners at the Case School of Med have done some surveying of the community, and I think that we're about to get that information from them. They did some general questions about, are you interested in receiving the vaccine and that sort of thing, and talked a little bit about who they considered trusted sources for medical information. So we're going to use that as we know that at some point in time we're going to need to market the vaccine to encourage people to take it. Right now, again, demand seems to exceed supply, but we'll get to a point, particularly as we get past the age groups, where we're going to want to talk to people specifically and say, here's the benefits to the vaccine and why it would be beneficial to you and your community. And so we're going to use that data, and we'll try and get some of that information to all of you in the next week or two. Talks a little bit about what is the level of interest in getting the vaccination. And then in terms of the hospital, assuming that people are positive, I have not heard that particular scenario, but I will remind us all that there is a difference in the number that we report as positive in our community and that KDHE reports, and that's because of a category called presumptive positive. And we only report, in our reporting on our dashboard, for example, people who've tested positive with a PCR test. And so there are other folks and there are other entities that report positives that were achieved through an antigen test rather than a PCR test. Because with the antigen test, the recommendation is follow that up with a PCR test to confirm. And so that's why we count that the confirm with the PCR test. And there are some folks who may have tested and results aren't back, and so those in some situations are referred to as presumptive positive. I haven't heard of a situation where if I test positive, then the other members of my household would be counted as positive. I think you may tell them to isolate. That may have been the message that they were receiving from the hospital, but I am not familiar with the situation that you described.
Well, just to be clear, I talked to this gentleman for quite a little while, and he said that they said that we would like to suggest that your family members are probably positive. He wanted to have them tested, and they refused. They said, we don't have any need to test them. We're going to just assume that they're positive. And that was the answer. And it was he was upset, and he thought if this is happening, in fact, he wants to come and address this before the BOCC. He may show up here soon and share his story. But the reality is, I guess I would like to know, if someone wants to be tested, again, my default answer is let's get them tested.
That would be my answer too.
Absolutely.
We've got folks at the Extension Center ready to test right now. So if he's listening, I hope he is able to get his family over there and get them tested.
Well, thankfully, he did get them tested, but they did come back negative. In his 14 day or 10 day window, he's recovered, thankfully. And his time has passed, and so his family's actually been tested at the tail end of that, and they came back negative. So I think they feel like they're in the clear. My final question was about the cycle threshold. If there's any way that you can answer that, would be awesome.
I wrote it down, and we'll follow up.
All right, thank you again.
Chairman, Tanya just forwarded me a note that probably germane to our discussion here, and Papoon just texted me over it, but hold on just a second. KAC's put out a note that Dr. Nielsen, Dr. Marcy Nielsen, is going to be available on Thursday, February 11th for a kind of a Q&A session. So we'll add your questions, the state level questions that you all asked today. We will put that into the queue to ask her. They want you to send questions in advance, and then we will have staff set on that. And I think you all are invited to that too, so I'll forward that to you in case you were interested in setting on that.
I was going to mention, I hope you all received, I'll send this to you, Tom, and you can send it to the commission, but it's, as of today, there's been 2 questions from county commissioners statewide about everything about vaccinations. And there's only 23 county members registered for this Thursday's webinar. And so they're asking for any and all questions before the end of the day today, and asking if, obviously, you're welcome to attend the webinar because Marcy's going to be on it from the governor's office. So every question that we had today, I think it's incumbent on the commissioners to send in. I mean, we can send it on behalf of the commission, but
Yeah, let's-
I think
let's-
they're taking questions from commissioners, and they want commissioners involved. And
They do.
That's exactly what we were doing today.
So let's have comms reach out, and if you have specific questions, and I've got several written down that you've already asked, but let's do it as a group and wait for efficiency, and we'll send those in mass. I would just invite you to maybe calendar the time and kind of sit in and listen to her talk. It'll be better than trying to catch her. She's on the news quite a bit too, but this way she has the audience is KAC. So we'll put more information out about that and begin to draft questions that we have.
I did submit 2 questions last week, so those are probably
The
ours.
two, those are the two there.
Okay.
Well, okay. Commissioner Lopez has a question or comment.
I just had I have a question and a follow-up with the story that Commissioner Howell brought up. I have heard where physicians in hospitals are saying, presume that they're positive just because they've been around. But it's hard for a hospital to test someone who's not a patient. So I would say if anybody's in that situation, to have them go through the county at the Extension Center or however it's easiest to get tested. If they come into the ER, we can test them, but if they're not actually patients, we can't really do medical treatment for them. So, but my question is, and I totally have it, I forgot. Oh, here we are, sorry. If we get to the point where we start receiving more vaccinations and we are having a hard time keeping up, would it be possible to utilize our partnership that we already have with WSU and say nursing students in their second or third semester could start helping with that volunteer of giving the vaccine? If they're have already been doing that, I don't see why we couldn't have them help, obviously under the supervision of their teacher or whoever that might be, but that might be a really good opportunity to get more volunteers and then also get nursing students real world experience before they graduate.
We have reached out to nursing programs, and so
Perfect.
we're engaging them in that process.
Okay,
But
thank
good
you.
idea, thank you.
And Newman University has a robust nursing program as well, so we'll reach out. I might just add, Tanya's also sent me, we're paying attention to the Johnson County website, and they seem to be getting the same amount of vaccine as Sedgwick is. So that's kind of keeping an eye on all the players around the state. So, but we do seem to be getting the similar or the same amount as Johnson County, so.
Yeah, it wasn't long ago, 3 weeks ago? 4 maybe at the most. We received 1,400 vaccines, and Johnson
Yeah.
County had 1,200. And although that might seem like a long time ago, that's only recent history. That just
Like
goes
everything
to-
else with COVID, Chairman, it's dog years now.
Oh,
Seemed
it
like it was
just
for, it
changes.
seemed like 7 years ago, but it's just a very few weeks. We've only had 3 weeks of consistent.
Yeah, we've had
vaccine.
3 weeks of 7,000.
Yeah.
And before that, we had 1,400.
Yeah.
So, anyway, well, thanks for all the effort, Tim, and thank you, Commission, for showing up this morning and all the healthy dialogue to our health officers. Okay. Have a good day, everybody, and,
A question.
Commissioner Howell?
Yeah, just, Chairman, I don't know, this is a staff meeting, we don't actually have a written agenda. I wanted to raise a question regarding House Bill 2193 related to the suspended driver's license legislation that's going to have a hearing on Thursday. I would like to testify on that on behalf of the commission, and I will be working on some testimony today and tomorrow, but somehow I need to get that to my colleagues to find out if they'll support that or not, and I would like to sign up to testify via Zoom on 1:30 on Thursday. So I wanted to at least let you know that this is happening, and I'd like to have your support to make sure you review the testimony. I'll try to get that out to you today if I can, through staff, I guess, and ask you to provide some commentary back to me if possible. So that's all I wanted
That'd
to
be
share.
fine. Can you update us to where the district attorneys and the sheriff's association feel on this issue? Because I think I recall we've been somewhat defaulting to the sheriff's association and district attorneys on this matter. So I don't mind you testifying, but personally, we were kind of defaulting to their position. And if that's all on the same page, that'll be wonderful for you to join.
Thank you, Chairman. I don't have the answer to that question just yet, but I hope maybe we can find the information on that.
Also, I'll just mention that tomorrow, I think it's at noon, Senator McGinn is hosting an update on the passenger rail item, and I've been invited to be a participant on that along with a couple other people around the state. So that is a WebEx or a Zoom meeting that's available to view if anybody's interested. I think it's noon for 45 minutes or so. Kate can, I think we're going to post the link if anybody's interested. Sometimes the public wants to know what's going on in passenger rail. Been wondering for 7 years now, but anyway. Okay. Anybody, other announcements? Commissioner Dennis.
Since we're hitting other subjects, let me touch on one. I just got notice this morning from WAMPO that we have the possibility, it looks like we are going to get another $4 million in the area in order to be able to support transportation projects. The question I sent back over to Jim Weber was, is this the $4 million that was earmarked for the North Junction, or is it an additional $4 million? And I don't have the answer back to that. But there is a possibility we'll get an additional $4 million that we can use for projects here, and we should get some more details today. I just wanted all the commissioners to be aware of that. Thank you.
Okay. And the announcements are clicking in our head, but Congressman Ron Estes is going to be visiting the Interest Arena or Distribution Center on Thursday, I believe. I'm not sure what time or when is it?
He had a scheduling conflict and has to be in DC, so it's actually been rescheduled to next Thursday, sir.
Okay, all right. Well, then, thank you very much for correcting that. Okay. Any other comments? Being none, thank you again for the conversation. We stand adjourned.